My name is Jared Leff, and I'm a Senior Research Program Manager here at CHERISH, based at Weill Cornell Medicine in New York City. So in this role, I provide administrative and logistical support to CHERISH. And so if you had met me at Thanksgiving dinner, what would I say I do? That means that I would say I consider myself the glue person, so holding things together, and that I help make the trains run on time. My role here today is to support the webinar participants and connect you and introduce you to the Pilot Grant Training Core Director. So without further ado, Dr. Brandon Aden is Assistant Professor of Medicine and Public Health here at Weill Cornell Medicine at New York City. In his clinical practice, Dr. Aden provides addiction treatment and primary medical care to patients with substance use disorder. Dr. Aden is also the program director for the Addiction Medicine Training Program at New York Presbyterian and has led the CHERISH Pilot Grant Program since its inception in 2015. Brandon, the floor is yours.
Thank you, Jared. Welcome, everyone. So I just wanted to welcome you all to our seminar today. So the goal of today is to give you all an introduction to CHERISH as a center and also give you an overview of the Pilot Grant program and then answer any questions that you may have. There will be some FAQs throughout the presentation, but if you have any questions, please feel free to put them in the chat. Jared is monitoring that and will let us know if you have questions as we go along. So this is sort of an overview of what we're planning to do today. As I mentioned, we'll do an introduction to CHERISH as a center and then the Pilot Grants program. Then we'll also have some Q&A time as well with myself, and we have a couple of former Pilot Grantees who are joining us as well today, Sierra and Bulat. And then at the end, we'll have any other additional questions you might have as well. Before I move on to introduction to the center, I would like to open the floor for Sierra and Bulat to introduce themselves. Sierra, if you'd like to introduce yourself.
Sure thing. And we should say a little bit about our project too, right?
Yes, please.
Great. Well, I'm Sierra Castedo de Martell. I'm an assistant research scientist at Chestnut Health Systems Lighthouse Institute. And I'm in the second year of my postdoc fellowship with the JEEP Initiative, which is one of the R24s that's part of the Consortium on Addiction Recovery Science. I'm a person in long-term recovery. A lot of the work I do is really informed by my past work in direct services as a peer provider. And some of that work includes cost effectiveness analyses of peer-driven interventions. And so that actually directly led to my pilot project, which was aimed solidly at filling one of the gaps in our parameters for those analyses. I did what's called a mapping study, which would allow us to take existing really high quality data about recovery quality of life and translate that into something called a utility weight for use in estimating quality adjusted life years. So we can open the door for more economic evaluations of different interventions that have recovery as an outcome of interest. So we've had all this wonderful movement in recovery science, but economic evaluations of recovery interventions have lagged way behind. So hopefully that will help. And yeah, I'm really looking forward to talking more about this pilot opportunity and answering any of your questions. Thanks.
Thank you. And Bulat?
Yeah, thanks. Hi, everyone. My name is Bulat. I am an MD by training, but now doing PhD at the University of Washington, focusing on health services research. So when I got an award in the last batch, I was a PhD student. Now a PhD candidate, which is a minor change. So my title of the program of the project is U.S. healthcare spending on HIV, HCV, and substance use disorders from 2010 to 2019. And I also look at variation by area and demographics. So the idea is that we know how much US is spending, but we don't know how much it is spending on specific diseases such as hepatitis, substance use, and HIV. And the goal is to disaggregate that spending and also look at the effectiveness of that spending overall. Happy to share more throughout this conversation today. And still, the project is ongoing. I just recently presented last month results at the Addiction Health Services Research Conference in San Francisco, but results are preliminary. And yeah, so the project is still ongoing. Happy to share more.
So just to give you a little introduction to CHERISH as a center. So CHERISH is a NIDA-funded collaborative center that is a collaboration between multiple institutions. So it's Weill Cornell Medicine here, BMT, Boston Medical Center, and the Boston University School of Public Health, and then the University of Pennsylvania and the University of Miami Miller School of Medicine. So the mission of CHERISH overall is to develop and disseminate health economic research, specifically in the areas of healthcare utilization, health outcomes, and health-related behaviors with regards to treatment and services for substance use disorders and for HIV and HCV and sort of the overlap between those disorders or those diseases. Just to give you a little bit of overview of some of the services that CHERISH does provide. So we have a training, we do some training. We also have a consultation services, and then we also have some resources that we provide. The CHERISH consultation service is led by Dr. Sean Murphy. He is our director for that service as well as a research affiliate program. If you do get a pilot grant, each of you will meet with Dr. Murphy in the first few months of your pilot grant, just to sort of get access to those services for consultation and linkages to people throughout our affiliate program if you need those additional help with your pilot grant. But this is a service that is available to anybody. So even if you're not one of our pilot grantees, please feel free to look at our website and sort of look at what that service will provide. It's usually 6 hours of sort of consultation with one of our experts around questions you may have, either with ongoing research that you have or with any sort of potential applications you're thinking about or other grants that you're applying for. And those are free and available to anybody who applies for them, and is run through Dr. Sean Murphy, as I mentioned. In addition to that, we also do have some trainings. We have multiple modules that are hosted online on our website that you're free to access at any time. As a pilot grantee or as not anybody can access those. We also do have some training specifically around dissemination and of your research. That is led through our University of Pennsylvania for the Leonard Davis Institute, which is headed by Dr. Zach Mizell. If you get a pilot grant, you also will do a training sort of one-on-one as a group with them at the Penn Leonard Davis Institute around dissemination of your pilot grant. So a little bit about the pilot grant program itself. So the pilot grant is a funding of up to $20,000 in a one-year pilot grant, research on health economics around substance use and the overlap with HCV or HIV. We have NIH funding for up to 3 awards that are for any institution, and we also have internal funding from here at Weill Cornell to fund one at our institution. A little bit about the eligibility for our pilot grant. So there's sort of 3 main buckets that people come to us for applying. One is if you're a CHERISH researcher yourself, so either one of our investigators, research affiliate, or on our advisory board. Or the next bucket is usually postdoctoral fellows or trainees. These are people who are working with one of our CHERISH researchers. And then our last bucket is sort of investigator nominated by a CHERISH researcher. So if you don't fit in any one of these buckets right now, just so you know, while you're thinking about applying for your pilot grant, please reach out to us and we can link you up with one of our CHERISH researchers to be your sort of sponsor for applying for the pilot grant. So if you are already linked with the researcher, don't worry about that. We can make those linkages for you. A couple of frequently asked questions that we get for this. You can apply as a PI, as a PhD student. So you don't have to be a postdoctoral fellow already. If you're a PhD student, you can apply. If you are a master's level student, you can't apply as a PI for our pilot grant, but if you're working with somebody who is eligible, you could potentially work on a project with them, but they would have to be the PI as well. If you already have a K award, you are eligible to apply for our pilot grant. We would just have to work with your institution to figure out what you could use the pilot grant funding for versus what your K award is funding. But you can potentially have both pilot grants. And at this point, I would like to ask Sierra and Bulat to tell us a little bit about how they applied for the pilot grant and if they had a sponsor or sort of how they were linked to it, and then how they worked with that sponsor when they were doing their application. Sierra, if you would like to take that question first.
Sure, happy to jump in. So my postdoc's at Lighthouse Institute. That's headed up by Mike Dennis, and he is a Cherish research affiliate, which would have been enough on its own, but he actually suggested that I link up with Catherine McAllister, who is way more directly involved in Cherish as the director of the methodology core, because she's done so much with economic evaluation in this space. And my pilot idea was solidly over in the methods core realm. Catherine and Mike, they both reviewed my application. They were both part of integral to, the actual plan as well. And I was actually at I was finishing up my doctoral studies when I sent in my letter of intent. But by the time that the funding would come through, if I were to get it, I knew I would be at Chestnut doing my postdoc by that time. So I, kind of applied as though I was going to be at that institution already. So if you're in a similar boat where you're going to be transitioning, as long as you know where you're transitioning to, you could certainly set it up that way. Because I ended up doing that. I met monthly with Mike, which, is kind of part of our existing supervision meetings, and updated him along the way as to my CHERISH project. And then with Catherine McAllister, I met her more at kind of key points that I'd written into my proposal. So at a few different decision points to review my work, as well as being intimately involved in the dissemination products as well. So just got her feedback on the paper, and we'll hopefully get that out in the next couple of weeks.
Great. Right. Bulat?
Yeah, thanks. Yeah, so looking at the slide, I'm probably in the category B and C. At some point in the past, I was a NIDA fellow at Boston Medical Center with Jeffrey Summit, a CHERISH researcher. And as I started my PhD here at the University of Washington, I've tapped into my pre-existing relationship with Sean Murphy because, again, in around 2016 or 17, I've had a consultation with him on one of my projects that I was working on back then. We worked on the paper together. So I've revived that relationship, and I just pitched the idea. So that then became a pilot grant. Yeah, so I think that's
Right.
Yeah.
All right, so I'm going to move along a little bit to the application timeline and overview for the pilot grant application process. So letters of intent are due in January 10th, and then that followed by the proposal submission in February, due by February 21st. And then between February 21st and April, we will do our reviews of the applications and then our ranking and decide on funding. And then notice of awards and funding will go out in May of 2025. Just for your awareness, the letters of intent, as I mentioned, are due January 10th. This is sort of an overview of what is part of the letter of intent. The letter of intent serves a few purposes for us. One of those purposes is sort of get an idea of what your project is, and then make sure it aligns with both the CHERISH mission and NIH priorities for health economic research. This also allows us, if you don't already have a CHERISH sponsor, and we haven't touched base before you submit your LOI, to figure out who your sponsor might be and sort of link you with the CHERISH researcher who can sort of help you with your application process, or if you need additional help with that. The other part is for us to make decisions about who might potentially be a reviewer for your application. So once you submit it, we have those in place as well. Feel free to submit an LOI, even if you're not positive you're going to submit an application. You don't have to submit an application just because you submit an LOI, but it does give us an opportunity to sort of reach out to you and sort of help you if you're having issues formulating your idea or making sure it fits with CHERISH. So if you're still thinking through it, please feel free to submit an LOI, and we can sort of work with you to sort of help with that process. I would say in general, about a little over half the people who submit LOIs actually submit applications. So again, as I said, if you're thinking about it but unsure, please feel free to submit an LOI, and we can sort of help you work through that and see if the application makes sense. All right. And then the research proposals are due at the end of February, February 21st. Our proposals basically model NIH grant submission proposals, so it gives you an idea if you've never submitted an application, what that sort of will look like structurally if you're submitting an NIH application. So it's a sort of way to sort of quote unquote practice if you haven't done that before. And then the only difference is you will email it to us. We don't have sort of a centralized way to submit this. You just email it to us. And these are the components that go into it. So your research plan, references, human subjects, timeline, dissemination plan, and then budgets support as well. And as I said, all of this will model after NIH application. So it's sort of very similar if you've already done an NIH application for something else. In addition to sort of the overall CHERISH goals and mission, this year we also have identified a couple of topics of interest for us. Your application does not have to meet one of these topics. So if you have an idea that's outside of these two, feel free to apply. But if you're thinking and you do have an application that sort of fits one of these projects or areas of interest, these are what we were looking at this year, specifically looking at delivery of care, harm reduction, substance use care, HIV and Hep C care in rural populations or in rural communities. And then the other one is looking at long-acting injectable medications for HIV treatment and prevention and for opioid use disorder treatment. And then for the proposal review, we will do between March and April. Again, we model our reviews after NIH application reviews. So there are 5 areas that we review: significance, investigators, innovation, approach, environment, and then the overall sort of score. Significance is sort of, does the project address the important problem or critical barriers within the field? Investigators are looking at you and your co-PIs if you have collaborators. Innovation is, does the application challenge or seek to shift current research or clinical practice paradigms? Approach is the overall strategy, methodology, or analysis well-reasoned and appropriate. And then environment is the institution you work at and does contribute to the probability of success. And then the last 2 areas we look at are human subjects and then budget as well. I did want to touch base a little bit about the budget. So you can use the budget in pretty broad areas. So it can be used if you want to purchase data. It can be used for time or effort for yourself, or if you have collaborators, or if you need to hire a research assistant or an analyst. It can be used for journal fees, conference fees, if you're recruiting participants for those fees, etc. So it's a pretty broad, open to what you want to use the funds for. At this point, I would like to ask Sierra and Bulat to tell us a little bit about how they used their funding, and if that changed from the time you submitted your application to the time you actually started doing the research, if you need to shift that budget, because that does happen frequently. Again, we'll start with Bulat this time.
Sure. So I had originally allocated money for the conference, which hasn't changed, and then the rest of the money was originally allocated to time and efforts, such as data analyst. And so that has changed a little bit, because originally the idea was to hire an existing data analyst from the existing team. Then instead we switched, and I've used that to support my FTE. So that has been a really great, it worked out really well for me. Yeah, so, but didn't change anything dramatically, I guess, from what we originally planned.
Okay. And Sierra?
Yeah, the bulk of my budget was on my time and effort. It was a skill that it was a methodology I really wanted to learn. It was new to me. I knew enough about it to write the proposal, but definitely needed some dedicated time to learn how to do it. So the bulk of the expenses were dedicated to that. I did have some consultation fees written in that I ultimately didn't end up using. And that was fortunate because AHSR was a little pricier this year than last year. So I ended up reallocating it towards that. Also allocated some money towards publication fees, so I could purchase open access publication in quality of life research, which is the journal I'm targeting, just to improve readership and make it have a little bit of a wider reach. And I did end up rolling funds over into an NCE period just because AHSR fell outside of that period and I'm still working on the manuscript. So that is also an option, which is helpful.
Thank you. Yeah, and as Sierra mentioned, no-cost extensions are quite common. We get that this is a one-year pilot grant, and so sometimes things don't happen within that year. So that's pretty common with our pilot grantees. All right. So I do want to talk a little bit about, in addition to sort of the money for the pilot grant, some of the other things that we offer as part of the pilot grant. One of those is our sort of communications that we offer through CHERISH itself. So we have a CHERISH, one of my colleagues, Bonnie Shea, who's going to talk in a minute, does run our communications here. She's a communication manager at Weill Cornell, as well as the CHERISH Administrative Core, and she spearheads our communication strategies, as well as managing our website and communication channels, including our social media. At this point, I'm going to let Bonnie introduce herself and talk a little bit about her role.
Hi, everyone. Thank you, Brandon. Briefly, one of the key ways that I support the pilot grant cohort is to write a profile feature. It's just one of the fun ways to put names to faces and also one of my favorite articles to write yearly. It's also a pretty well-received blog. It gets shared in our newsletter, social. So it's just another way to also get your projects and your names across our CHERISH network. And my support continues throughout the year and even past your pilot grant period because pilot grant activities might continue after a year, and whenever activities such as publications, conferences, whenever we hear news of it, it'll get funneled to me and I'll work that in our editorial calendar. And yeah, that's a brief summary. And before I end, I'll also drop in the chat just a couple of articles and blogs that we've highlighted from our pilot grantees. So thank you.
Thank you. So as Bonnie mentioned, if you are one of our pilot grantees, at the very beginning of your pilot grant, you'll sort of meet with her to create a blog, introducing yourself as well as your pilot grant and sort of announcing that your award through us. In addition to the services that CHERISH offers through Bonnie and sort of getting your information out there, as I mentioned earlier, there's a dissemination training that occurs through Penn LDI. Dr. Zach Mizell runs that training, and you'll meet with them usually late fall, winter time during your pilot grant. During that training, you will meet with the year prior pilot grantees, and then it'll be your cohort as well, and sort of get an idea of how they were doing dissemination for their plan and sort of to think about and plan for dissemination of your research. In addition, you will meet with Jared and I quarterly during the process of your pilot grant. Those are check-ins to see how things are going with your pilot grant, if there's any additional help or thing we can provide at that point. So if we need to connect you to additional mentors, if you need some specific training around specific methodology, et cetera, making sure we make those connections. In addition to meeting with Jared and I, you will also meet with Dr. Bruce Shackman, who is the director for the CHERISH Center overall. And those meetings are really geared towards thinking about career mentorship and sort of developing your career. You will also meet with Dr. Yuha Bao, who is the director of our mentorship program, to get some of that guidance as well as thinking about your career long-term and sort of where you're going. And you meet with them usually once in the sort of middle of the pilot grant to talk about them, and then you'll meet with Dr. Bruce Shackman at the end as well. In addition, you'll present to the CHERISH overall, both in the fall and then in the spring. And those are opportunities to sort of network with the CHERISH leadership more broadly and sort of think about your career and sort of where you're going, both short-term and sort of long-term. For our purposes, a couple of things we track for your pilot grants are looking at manuscripts, conference presentations, and grants that you might submit. subsequent to your pilot grants. And a few other things are sort of softer outcomes, any skill sets you develop, collaborations you develop, either through Cherish or outside of Cherish, and then mentorship and training. At this point, I would like to ask Sierra and Bulat to tell us a little bit about what, and you've already mentioned some of this, what your outcomes of your pilot grants have been or are going to be. Bulat?
Yeah, sure. So I've already mentioned I've presented some preliminary results at the conference HSR. Plan to present later again as I have final results. And then manuscripts are in the development. Hopefully we'll have 3. And then I also wrote 2 grants, which unfortunately were not didn't go through, but haven't gave up yet. So hopefully we'll build up something. And of course, all the soft outcomes, I guess, could be again, mentioned here. So skill development in the progress as I work on this analysis. Collaboration is enormous. Obviously, there's a great, I think Cherish has a great community, both in person and online, always there when you need them. And as well as mentorship and training is just great.
Sierra?
All right. So I have 2 main results products. So there's a mapping algorithm that other researchers can pick up and use. It accompanies the dissemination products. And then there's also the main results themselves. So this key parameter that other people can use in their economic evaluations. So those are packaged as 2 different dissemination products, which is the AHSR poster presentation, and then this manuscript that we plan to submit in the next couple of weeks. And in addition to that, we've written a grant for an R34 to continue some of that cost effectiveness work. And I think that, we got a decent score. Ultimately, it wasn't successful, but I think that having this Cherish pilot definitely helped to demonstrate that, we have expertise in this area. We've done some serious work in this area such that we can identify, some of the challenges. I also was recently awarded a diversity supplement that was submitted before I had any results for the Cherish project, but I had been awarded it. So I think that certainly contributed to being awarded that diversity supplement because, it demonstrates that there's some ability to manage a grant, to take a project from conceptualization to completion, those kinds of things. And those stepping stones really build on each other. We also had kind of baked in a step 2 of this project that I was able to get a paid intern through Chestnut, and was able to hand off that piece of the project to her. And so I even got to the opportunity to develop as a mentor myself as part of this process, which has been really cool.
Great, thank you. Okay. And just a little bit more about what's next for our pilot grantees. So as Sierra and Bulat both mentioned, they are prior pilot grantees. After the completion of pilot grants, many of our pilot grants go on to have other affiliations with Cherish. So Dr. Yuha Bao, who I mentioned previously, runs our mentorship program. And we do have a mentee group. So many of our pilot grantees have been invited to join our mentee group, which is a year-long sort of mentorship program. In addition, we have our affiliates program, and then also our many of our pilot grantees go on to be mentors for pilot grantees in the future. And at this point, I am going to open up the floor for any questions, if anybody has any.
And if not, no worries. We have several lined up as well.
Yes, we do have our own if you don't have any.
I have a question. My name is Bridget, and I was just wondering if we get any feedback on the proposal, like the full grant proposal or the letter of intent to kind of work on it and try to improve it.
Yes, so for the letter of intent, as I mentioned, we use that so one to see if your pilot grantee or your pilot grant proposal fits with Cherish. And we will give you feedback. If it's already great and in shape, we'll basically say yes, please apply. But if you need feedback or if you have questions, we will give you feedback to sort of make it more aligned with Cherish or maybe sort of change the methodology, etc. If you really sort of don't have you're really sort of in the dark about what you're going to do, or sort of not sure what you want to do for your application, we do highly recommend you reach out to us directly. You can email us before even you submit your LOI so that we can sort of talk to you and sort of figure out if we can help you best fit one Cherish and make sure you're not sort of spinning your wheels and doing things that aren't going to be helpful. So you can reach out to us even before that. But yes, you do get feedback on your LOI. And then for the application itself, whether it's funded or not, we typically give feedback to you as well. So some of that would be your actual reviews, obviously. But sometimes we've had applications where like it didn't get funded because we can only fund so many, and encourage you to apply the next year. But also we'll try to recommend if there's other ways of getting funded that we think might be good for you, sort of directing you to those sources, or helping you sort of tweak it to suggest that it might be fit here better or some other place as well. So yes, you do get feedback for both of those. But in addition, please feel free to email us at any point. Sort of, if you have specific questions or sort of general questions, we can give you feedback before those or outside that process as well.
Mm-hmm. Okay, that's great. Thank you so much.
Sure.
Julia.
Hey, thank you. I wanted to ask Sierra and Bulat, I know you spoke to a lot of the different ways that the pilot money has been used and what you got out of that additional mentorship, but could you speak to maybe the most valuable piece of this experience, or also maybe the most surprising that was really helpful in your research?
Sure. I'll be happy to start, Sierra. So I think this came out from my conversation with other PhD students. Is it's not entirely obvious, but I caught myself on one thought, is that I originally, before I had this proposal, I wasn't kind of thinking that I will tie myself to that particular research topic and the methodology. And so I used the CHERISH grant in a way to validate my thinking. So I was thinking, oh, this is very, very, very cool, very interesting. So hasn't been, so to explain this, I have to maybe just explain a little bit about my methodology. So what we're doing is that we're looking at the healthcare system spending entirely overall, and also disability adjusted life years entirely overall in the population, which isn't a common methodology. So I was super excited about this methods and application to our particular field of substance use research in HIV and hepatitis. So I thought, oh, maybe we can do that, and it will stick. So then I will develop that further. And so that was really great for me to have this oversight from mentors, as well as going through the review process, as I got very, very helpful questions on the revise and resubmit stage of the proposal. So yeah, so that's probably one thing to mention.
I think one of the most valuable things was getting this kind of it was a very odd project. I needed to learn the method. I needed the dedicated time to do that. It's definitely an important problem in this space, but it's a very, very niche problem at the same time, right? So the fact that it was really a good fit for this opportunity, and that it was like simultaneously a small enough problem that the fit made a lot of sense. But it's also too big to just, do in my own free time, what is free time anyway. And so having that dedicated time, that dedicated space, and to be able to tell, my mentors, hey, listen, I've got to work on this project, right? That is an incredibly valuable piece. And I mentioned it in the chat already as well, but just all of the feedback and the mentorship that's available as part of it, tackling something like this where I needed to learn new skills as part of the process, I had this wealth of experts and expertise to draw upon whenever I needed it to get that additional help and make sure that this project could come to fruition.
That's great. Thank you both so much.
I see a question from the comments, so I'm going to read it out loud from Rachel Ross. Given the budget, any advice on how we should think about the scope of the project?
Yeah, I'm happy to jump in. I certainly have had this with my dissertation as well. The tendency that I tend to have, and many of us in this field have, is to get a little bit too big with our projects. And so finding something that needs to get done, but can be done realistically within a year, that's really the right size. That's definitely a challenge, and a challenge that I faced as well. Thankfully with this project, I'd run into it enough times where I knew that it needed to get done and that it was probably manageable in that time frame. But just in general, that is something that I've struggled with is managing the time frame. So getting feedback from more seasoned researchers, people who have, done projects that are at all sorts of different time scales, that was really helpful for me to make sure that it was the right size.
Yeah, so I can just add maybe what Sarah just said. I think my project is large enough so that it was at first giving me a bit of an anxiety when I had the regular checkup meetings with Brandon and Bruce and others, and I was like, it's so huge. I just barely started. But then the amount of support and the questions I was having on this like regular checkups was really helpful. So I'm kind of still wrapping up my project, but I don't have these meetings anymore. But yeah, I think you're not going to be punished if you're not if like you kind of the it's larger than what you can bite. You're gonna bite it and in a small chunks eventually anyway. So I wouldn't be worried about that.
Yeah, I mean, we're sort of aware that it is not a huge budget. So we will, in the application process, we too try to sort of, if somebody submits an application, we're like, this is too much, you're not gonna be able to do all this, sort of help you wean that down. And if that means, for the pilot grant, you're only doing one of the aims that you initially are thinking about, and then additional aims like will be additional research or go through some other process to get funded. But we will sort of help you try to do that as well. But we understand, and it's also completely reasonable that, as Bulat mentioned, we realistically do not expect you to be done with your project by April of 2026, like the following year. By the time you get the notes of award, get the money, et cetera, and start doing the actual research, we don't expect that to happen within a year. So no cost extensions, I would say virtually every pilot grant ends up doing a no cost extension, and sort of the research sort of carries over into the next year.
I have a follow-up question on that. Does that mean if we propose a realistic question that could be done in a year, that we won't necessarily be reviewed as highly because it's less ambitious?
No, not at all. I think it's sort of a regardless of where you sort of fit in there during the application, we'll sort of help you either in the LOI before, be like, you need to narrow this down or broaden it, or during the application, we'll come back to you and be like, okay, this is great, but maybe you need to cut out this much if it's too big, or if we think it's too narrow, maybe you should think about doing these things as well. So we sort of help guide you do that. It's not so rigid of a process, which is sort of, I think, the nice thing about the pilot grant is sort of we can sort of help you work through that to make it most useful and valuable for both you and for us as a learning experience, and as well as for the actual research itself.
And can I mind if I add to that just to illustrate? I mean, my project was done within the year, but I had expenses that carried it into the next year. So I had AHSR that fell outside of that 1 year time frame, and then the publication fees as well.
I'm curious for the awardees, what sort of, I know at least one of you used funds to cover your own time. What kind of percent FTE were you able to cover with this award given? Like, I know you had conference expenses and that sort of thing. Just trying to get a sense of like scale I should be thinking about.
So the FTE depends on your rates at the institution, and I think they're super variable. It depends. So maybe I don't understand the question very well.
I'll jump in and sorry, I just saw the comment,
Yeah.
Tristan. Yeah, so really it's if you want to use the entire 20,000 for your FTE, if you can justify that in the application, that's great on our end. So in other words, and as Bulat is mentioning, then depends on what your rate is for how many hours we can then cover.
Yeah. Yeah. No, that makes sense. I was just trying to get a sense of from folks who've done it, what they did, but okay,
Yeah,
thanks.
and yeah. So in other words, if like we've definitely had applications where they spend the entirety of the pilot to support, for example, like an analyst, and they're like, "Look, I don't have this skill set, but I know if I worked with someone that does, they could help me get there." And we've been happy to fund those types of projects. And yeah, if you run into any specifics, reach out, and we're happy to talk you through.
Thank you.
And I think I just saw a new question, which I'm going to read out loud. It's from Dr. Sarah Gutkin. Can you speak to the turnaround time regarding the LOI feedback? How quickly can we expect feedback on the LOI before the full grant submission? And would it be possible to submit the LOI early in order to give ourselves more time to incorporate any suggested changes?
Being transparent, it depends on how many LOIs we get, how quickly we give you turnaround feedback. But in general, we try to give it back to you within a week and a half or 2 weeks, just so you have at least a couple of weeks to make any adjustments. Yes, you can submit your LOI earlier. That's fine. You can also send us emails directly if you have questions, specific questions, or sort of general questions as well. And we can try to give you answers or feedback or suggestions well before that, starting today. If you want to email us if you have specific questions, and we'll give you that feedback generally in real time or in 24 to 48 hours. But the LOI generally we try to do within a week and a half, but it also depends on how many LOIs we get, how quickly that will actually happen. But generally it's that fast. And depending on how big the concern may be, that may or may not be enough time for you to make adjustments for your actual application. But if it's relatively small or minor, then you should have enough time to make any adjustments.
And I'll throw this out there. We have had folks who really the adjustments are pretty significant, and what they end up doing is applying the following year. I mean, they have to submit an LOI the following year as well, but in that interim time, they've really, thought it through and been able to turn it into something that does fit our criteria.
Yeah, I mean, that's typically when that happens, it's typically because they submit an LOI and it really just doesn't fit Cherish, the project they're proposing. And so sometimes in those cases, as Jared mentioned, they will rework it or come back with us something a year later. Sometimes we recommend they get a consultation through our consultation service and sort of help them develop the project and potentially submit funding through some other mechanism or some other agency or directly to NIH or whatever that happens to be. That's not terribly common, but it does happen where we're just like, this just doesn't fit Cherish. Let's see what we can do to help you get, if that's a project you want to do, how we can help you sort of get that project moving forward. But
yeah, I don't see any more questions in the chat.
All right. I would like to ask both Sierra and Bulat just one more question. As you were putting together your pilot grants, what do you think was sort of the most difficult thing for you to do as you were thinking about doing your pilot grant?
I think for me, the most difficult piece was that I really, again, it was acquiring a new skill as part of the process. So I didn't know that much about the method that I was proposing to use. And so I was asking for that dedicated time to learn how to do it and then apply it, right? But what was helpful is that I did get the opportunity to submit a revised application. Some of the feedback on the application made it clear that, whoops, I need to include this other element in my proposal. And so I was able to thankfully work with my mentors and get that integrated and get that resubmitted. quickly. But, I mean, in an NIH grant application, you just get that reviewer feedback. You don't necessarily get to respond to it and resubmit that same application to those same people for the same opportunity. So it was very valuable to be able to do that and to be able to kind of tackle something that's totally new. And that's a little bit more of a risk. I mean, that's like one of the beauties of these pilot opportunities is you can do something that's a little bit outside of your comfort zone because it is supposed to be also a learning process, right?
Yeah, definitely, I agree with that. But just one thing to add is I think it wasn't entirely obvious to me the amount of paperwork that needs to be done, not only by me, but also by people at my institute that need to connect with people at the CHERISH Institute. So that's, I think just starting early would be super helpful. And also we had some internal rules at my university. I think Julie and I were just talking about it. There's some rules on who can and cannot apply as a PI, and then how money is being distributed. That's always a challenge. So probably starting early would be helpful to get through that red tape.
Right. All right. If there are no additional questions, I will end there actually. Jared, I'll let you take over.
Yeah, no, so I just put an evaluation in the chat and ask they if you've got a couple minutes, click on the link and do the survey. I'll also send it around by email. And just want to say a really special thanks and note of appreciation to our guests, Dr. Sierra Castedo de Martell and Dr. Bulat Idrisov, who took the time to spend with us in preparation as well as during this hour today.
Great. All right. And here are just a few FAQs to end. As I mentioned previously, if you have any questions, please feel free to reach out to us at any point, email us, and we generally will get back to you pretty quickly with those questions as you're thinking about your LOI and thinking about your project over the next month. Other than that, it was nice. Thank you for joining us. Everybody have a great holiday, and Happy New Year.
Bye-bye. Thank you.